Nestor Wilkie, a nurse unit manager in Contoso Hospital, treats high-risk patients. He's in constant and at times urgent communication with other nurses, doctors, and health professionals across the care team and hospital. It's imperative they work together to deliver safe, high-quality, and compassionate care for their patients. To do this, they deserve a seamless technology experience with rapid access to information and the ability to communicate, collaborate, and intervene easily while safeguarding patient privacy. The right system can save time and money, as well as help improve patient outcomes. Microsoft Teams brings together patient information from traditionally fragmented health systems into one place for communication and collaboration that ensure the smooth handoff of patient information. Microsoft Teams is a hub where multidisciplinary care teams can collaborate in a single place that keeps the patient at the center of everything they do. Teams is designed for the whole healthcare organization and all healthcare workers, from staff to administrators who work across clinical and non-clinical departments like pharmacy, facilities maintenance, billing, imaging, and social services. Teams provides communication and collaboration channels to break down traditional organizational silos. Nestor begins his shift reviewing patient status and addressing requests and tasks passed on by colleagues and previous care teams. Teams provides a single and secure location for the care team to communicate, coordinate patient care, and improve operational efficiencies. It brings together everything his care team needs in one location: chats, meetings, files, calls, tools, and familiar apps his teams are accustomed to using throughout the day. Nestor opens the high-risk patient care team's discussions to view current patient status. He has access to a single virtualized team centered on a specific topic to keep work together and collaborate on office documents. The team has access to persistent and threaded conversations about different high-risk patients needing attention, as well as huddle topics and history. Messages directed at Nestor are marked with an @ symbol so he can attend to immediate needs. He replies to the doctor's direction regarding a patient's NPO, or nothing by mouth, status. Teams ensures consistent and accurate patient information handoff across the care team, so Nestor shares the right information at the right time. Because he stays in one location for meetings, chats, and discussions, he minimizes context switching and can find needed information quickly to make accurate decisions and interventions. Channels in Teams are built around specific topics and provide dedicated hubs to hold meetings, have conversations, and work on files together. High-risk patient care teams can structure their work and reduce duplication of effort and tasks. Channel tabs allow team members to pin additional information sources and reference materials. Channel meetings incorporate the power of Teams audio, video, screen sharing, recording, and transcription features to manage daily meetings. Anyone can schedule meetings or conduct meetings on an ad hoc basis when the team needs to huddle quickly. All members of the care team can join or be added to a meeting, and their discussions can be recorded. All chats and notes shared during a team's meeting are kept with them and accessible later for quick reference. Clinicians can easily configure the ward and hospital templates to predefine a team's channels, install applications, and pin tabs automatically, allowing them to focus on care collaboration rather than spending time setting up a time. Templates allow healthcare organizations to streamline operations and deploy consistent teams across the organization, while remaining customizable to meet every team's specific and specialized needs. The team within Teams is a digital representation of the care team, and the channel is their workspace. Tabs provide easy reference to the tools they use regularly, and the persistent conversation offers historical information. Nestor can see that he has another @ mention in the discharge planning channel. He replies to Lynn's message and attaches or uploads the discharge document to share with the team. Teams provide secure content sharing and collaboration, which can be shared with healthcare employees at any point in time, with the assurance that important documents aren't edited or shared outside of the organization. Realizing other team members might have similar questions, Nestor creates a tab and shares the discharge procedures document. Teams integration with SharePoint allows healthcare team members to quickly add tabs to provide access to information, all while staying in their workflow. Microsoft Teams brings together information from siloed operational systems such as the EHR, electronic health record, using fast healthcare interoperability resources, FHIR standards. The care team will need to track TINA's and other readmitted patients' care plans in the MDT or multidisciplinary team meeting, so Nestor creates a new list to track all readmissions. The Patients app surfaces the EHR data directly within the care coordination channel, allowing the high-risk patient care team to dynamically collaborate around patient information, all within one secure hub, minimizing switching between various apps and tools. Clinicians can collaborate around the logistics associated with care coordination, like making notes around release sign-offs, notes about family visiting for rounds, and more. Part of Nestor's duties as shift supervisor is ensuring the nurse station has everything needed for patient care. Power Platform integration in Teams allows hospitals to quickly build low to no-code enterprise-grade web and mobile apps right where their business happens. The low barrier to entry of the Power Platform fosters innovation without limits while staying within the boundaries and management criteria set by the IT department. Apps like the Inventory Request tool not only remove the overhead and cost of a hard copy paper trail, but also reduce time waiting for supplies to arrive by increasing interdepartmental efficiency. Hospitals today have multiple campuses across multiple cities. Teams breaks down the silos of healthcare amongst the different divisions and campuses and allows disparate organizations to communicate and collaborate openly and gather and share insights quickly and easily. Nestor wants to investigate Contoso-wide healthcare factors. Power BI, a business analytics solution, allows healthcare organizations to analyze and visually present data across the organization so teams can quickly infer actionable insights to improve patient outcomes. Nestor is tracking the risk level of oncology patients entering the ER. Healthcare organizations can connect to hundreds of data sources and bring that data to life with live dashboards and reports that can be embedded directly into apps, websites, or tabs right in Teams. By filtering on the high-risk level, Nestor can see which age groups and which hospital units have the highest level of risk in oncology. Nestor would like an oncologist to look into this risk factor. What are the causes and possible solutions? Gone are the days of sticky notes on the edge of the nursing station desk or pieces of paper tacked to the bulletin board. Contoso takes the chaos out of cross-hospital work and gets more done using Planner. Care teams can easily create new plans, organize and assign tasks, share files, chat about what they're working on, and get updates on progress. Nestor is confident that his coworker, Patty, will know about the task and will help find a solution to a potential hazard. The high-risk patient care team has a weekly MDT. Since Nestor's care team is often on the go and in-person meetings can be challenging, they use Teams. Built on the Office 365 hyperscale, enterprise-grade cloud, Microsoft Teams helps healthcare organizations accomplish their security and compliance goals. Teams meetings safeguard sensitive and protected healthcare information, or PHI, with features such as background blur, ensuring any information displayed behind a meeting participant in a video conversation is obscured. Furthermore, meeting backgrounds can be personalized to ensure team meetings adhere to organizational brand and professionalism standards. Team meetings empower clinicians to stay on top of their fast-paced operations and participate more effectively in the right meetings and workflows. A complete meeting solution, Teams meetings support screen sharing, video, and audio conferencing accessible from nearly anywhere. Not only do meetings give clinicians a way to relay the most relevant patient information to support strong handoffs across the healthcare team, They also capture the information for future reference. Clinicians can access meeting recordings with transcribed text that are indexed, searchable, and can be translated with a simple click. The flexibility of Teams meetings allows clinicians to conduct all types of meetings, no matter if they're spontaneous, scheduled, simple team huddles, or formal meetings with internal or external health providers, including large one-on-many meetings. Nestor needs to review his schedule for next week. Instead of having to go to the break room and check paper schedules, or an office to check multiple systems, Nestor can use shifts right within Teams. Shift integration in Teams allows Nestor to quickly review his daily and weekly schedules, request or accept time off, offer or swap shifts, and easily stay abreast of any shift schedule changes within his department. Nestor needs to schedule an annual training and certification session mandated by the hospital. He quickly adds Alex Wilbur, the compliance officer, to the HRPC Team A schedule in just a few clicks. Nestor books the time for next Friday. Color codes the meeting to make it visually stand out on the schedule, and includes a note to provide context for Alex. In a few clicks, he updates the schedule and shares with both his team and Alex. Microsoft Teams brings multidisciplinary care teams together to collaborate in a single place that keeps the patient at the center of everything they do. A seamless technology experience with rapid access to information and the ability to communicate, collaborate, and intervene easily while safeguarding patient privacy. Microsoft Teams brings information together, traditionally fragmented across multiple health systems, into a single place for communication and collaboration that not only ensures the information remains secure, but saves time and money while improving patient outcomes.